we had an opportunity to get some things right, and we missed the opportunity. But now we've got people who are on track to do things that are in the mindset that are to do things that get us back on track. I'm talking about Dr. Debra Houry, who's been with us before on my show, and she's a senior fellow at Yale School of Public Health. But her story is it's a story of rebound. I guess I'm going to put it that way. Where about a year ago, she made the decision that enough is enough, and decided that it was time to leave. Unfortunately, chief medical officer at the CDC, and but she got her footing and partnered up with some other great minds and said, we still have so much to offer to our country. And she's back in the fight and has been back in the fight, really never left the fight, just kind of changed the way in which she was fighting. Dr. Houry, welcome back to Choose View. Sorry about that long intro, but I wanted to give you some early flowers into, where you've been, what's been happening. Bring us up to speed. Has it been a year? I was looking at my calendar, is going, we're coming up on about a year's time now. Am I right?
Yeah, later this week, it'll be 1 year after I walked out of the CDC, but certainly that wasn't an overnight decision. It had been really leading up to that with all the issues internally that we were having with the secretary around political interference. But since then, have been trying to continue the work of public health just in different ways. So working with California, several states out west, around innovation, bringing, modernized data, certainly following evidence-based guidance and not what is currently coming out of the department, around things like vaccine recommendations and preventative care, and working with many health tech companies, and continuing to use my voice. I've done many congressional briefings, continue to do media interviews and national talks, just really around what's happening in our country and how each of us can really take care of our own health and be aware of what's going on.
Is the conversation around, I'm going to say self-empowerment, because that's the word that comes to mind. Whenever we have a crisis that's a medical crisis or a health-related crisis, one of the first things that I think my experience has been is, okay, what can I do to make sure that I'm taking care of myself and those around me? And I know that you, as a doctor, know that that's a big part of the success of getting through something that's a health issue, a health crisis. Are you getting any sense that Americans at large are saying, I have to be more responsible now because I'm not really getting the help from or the guidance from the federal government because there's such a cluster, going on with the CDC and more specifically with RFK Jr.?
I think that's difficult to answer because, some people will listen to the secretary, and or the president, and when they say things like, splitting up a vaccine into 3 components, can happen. People might think that is actually could happen when the FDA and others have said it would take, one of the pharmaceutical companies said it could take up to 10 years for that to actually happen. And 100 of our peer nations don't separate it out into 3 components. And the things that, they said would make that helpful, like spacing out the vaccines actually puts an undue burden on parents, and things like febrile seizures, which you can get sometimes after having a high fever after a vaccine, that just would increase it. So it doesn't make any logical sense. But, if you hear from a political figure with authority, you might think that it makes sense unless you have a medical expert unpacking it, which is what myself and others, like the American Academy of Pediatricians has been trying to do. I do think people that are aware of where these scientific issues and misstatements from the administration are trying to have more self-empowerment, but I worry about the implementation across communities. It's going to cause have and have nots when we look at access to many of these medical treatments and vaccines, and that's what concerns me.
What is your assessment of the relationship between the federal health minds and heads of some of the federal agencies in relationship to, or their relationship to, the state level medical directors and health experts? Is that gotten worse? Has it gotten better? Or has it stayed the same in the last, let's just use a year ago as our marking point?
I would say it's gotten worse. At least 28 states now no longer follow CDC's vaccine recommendations. And in general, a lot of national organizations, like the Association for States and Territorial Health Officers and Council for State and Territorial Epidemiologists, have been convening states, to have shared information on things like even some of the foodborne outbreaks, so that states have a place to where they can share how they are incorporating the best available evidence. But unfortunately, there's much more of a disconnect. And when you look at federal agencies, I think most people used to really aspire, not most, but certainly experts and leaders would aspire to lead a federal agency, and it was really based on your expertise. And now we're seeing people that never completed medical residencies or aren't board certified leading many of these agencies, like the NIH director, And so I think when you see that, you start to question the expertise. And so many of the states have been going in different directions and following the World Health Organization as well as medical organizations.
Really? So there's, wow. So reaching outside of the quote, United States brain trust that we've had for such a long time, and finding support from others. So do you know much about, or are you hearing much about, is maybe a better way of putting this, the federal government putting additional pressure on state medical directors and health state experts to follow their way, or else we're going to, cut support further, or we're going to, create some mandates that, your state must follow? Or is there any of that going on that you're aware of?
I think there's a concern that could happen when you look at some of the grant funding announcements. Recently, there has been language put in place that grants could be canceled if they don't align with administration priorities. I know that's something that there was a big federal comment on recently because there's concern about that. Many months ago, several blue states did have funding canceled. I believe it was reversed in a lawsuit. But in my mind, this is just not the way to run a country. It should be blue and red states being funded to protect the health of their communities, and not whoever the president is, deciding whether to fund those that voted for them or not. It should be about protecting everybody in our country. So it's been highly disappointing that our leaders apparently don't care about everybody equally.
Yeah, this is an area that should not be partisan as it relates to what's being put out and then what's being responded to. So you're right on point there, as always.
I mean, as an ER doc, you wouldn't want me asking you what your political affiliation is before I treat you. You'd want me to treat you regardless. So that's how I view how we should be protecting our communities.
Without a doubt. And the same is true for virtually any form of medical treatment.
Agree.
It's like whatever it is, I don't care necessarily, neither should I as a patient. And I would hope that the doctor, that's why you all go through so many rigors to be experts in your space, so you can treat the situation, diagnose and treat the situation, versus, hold back because a person may not, believe what you believe in, or see the world the way you see it. And religion is starting to creep into. I was just sharing this with my wife, that there's people now that are being viewed differently because of their religious beliefs when it comes to treatment, or at least the federal where this administration is trying to go. Let me clean that up. Is to determine how treatment will be meted out based on how people have denoted where they are with faith. And that's a very, very slippery slope. And I know you probably got a better thumb on where that's coming from, or where that might be headed.
Yeah, I think it is a slippery slope.
Yeah. Dr. Houry, let's take a quick break, because when we come back, I want to talk about a couple of articles that you've recently written, and some interviews. And I also want to get a little bit into, we talked about folks that have been appointed, and I want to get your thoughts on some of the, I made her smile. Let's take a quick break. The number is 773-763-9278. I'm Richard Chu. Keep it locked in. We'll be right back with more of Chu's Views. All right, guys, welcome back to Chu's Views. Thanks for being with us this morning. With us is one of those just voices that's made it so clear that we could do so much better in the medical space that we're in. Dr. Debra Houry, who a year ago, coming up on a year ago, made a decision, or as she said earlier, one that wasn't made haphazardly, that it was time to move into a different direction and still have her voice be a part of the strength that we need in our medical community. You, as all of us, are aware of what's going on with these foodborne allergies and outbreaks. E. coli, salmonella have always been ones that we've talked about, but more recently with this cyclospora, it's got people checking their iceberg lettuce when they go to they get it home from the grocery store. How did we get to a point where this is something that pretty much anybody in the country we have heard about it because of what it's causing? I think that the crazy thing about it is the medical impact that it's had on people has almost been turned into, a comedy routine. But the health risks are, pretty large. Talk to us a little bit about this.
Yeah, I think, certainly throughout different periods of the year and in summers, every year, we see surges in some of these foodborne outbreaks, and different types of foods are, subject to recalls. So that part is not unusual. I'd say what is unusual is the amount and the number of people impacted. And I'm not quite sure why it comes as a surprise to the administration when you lay off people at FDA and CDC that track illnesses, that track food recalls, that help with safety. You're not going to have the same capacity. And so, CDC and FDA are doing everything they can at this point, but certainly when you have, at least at CDC, 30% less staff, that means 30% less staff responding to a measles outbreak, to a foodborne outbreak, Ebola abroad, as well as just the day-to-day public health. And so we are seeing, much more of this. I think it also doesn't help when, the secretary is busy doing cooking shows versus talking about the food outbreaks that we're having and how you can protect yourself, and just being much more public out there. He can certainly do both, but he needs to also be talking about the health impact and health threats that are going on in our country.
Yeah, it's a question of priorities, of which thing is first on your to-do list, and taking care of the people that are part of the country is certainly should be first. You had a great article from Nutrition to Vaccines. Here's what MAHA policies failed to deliver. Talk a little bit about that, if you can.
Yeah, and it was interesting because I did a podcast a week or so ago as well, where I was on with several MAHA supporters, and we
Mm-hmm.
all agreed that the executive order around childhood vaccines, none of us supported. And so I think there are a lot of things that we can find in common with MAHA. I mean, I think everybody believes in safe food and water, and seeing children thrive and ending chronic disease. But when people have significant conflicts of interest when it comes to vitamin supplements or other wellness things and don't disclose those, and then promote guidance or products that have those, that's a problem when you're not being transparent. When you look at some of the things that has happened recently with pesticides, that seems to go counter to what MAHA wants. So I think finding those common ground areas, as well as the secretary and the president talk about gold standard science all the time. I believe in gold standard science. I am a scientist, but a retracted study or a tweet is not the same as a well done clinical trial. And I think we have to say that. It's sad we have to say that, but not all data is the same. And when we have accurate or valid data, we need to be using that to drive decisions and not personal preferences and then trying to backwalk it. So I think there is a lot that can be done around safer food and water, more transparency around data. And certainly listening to people's lived experience. And as I've been out this year, I've been doing a lot more in communities, and I welcome the opinions and voices of those in the community. And I think we can find a lot to agree on. I think just unfortunately, the current administration really isn't listening to their constituents either, and might be saying one thing and then doing completely another, which doesn't make food and water safer, as we're currently seeing.
Yeah, because as you said before, medical conditions don't necessarily have a political stripe. I mean, if something happens that impacts, the best example recently, obviously, is COVID. There are people from across all political, camps that were impacted by COVID, and whether they contracted it or they knew someone that did, or our lifestyles were changed because of it. So the fact that we would even think about reducing the people that we have in agencies that are designed to help, if not prevent something like that, certainly make it less intense, is without any, there's no reason there at all. And I always have to ask this question, and for particularly someone like you, what's the basis of that? Because it is a nonpartisan issue. And unless we get into economics and how much people have in terms of resources to pay for medical treatment, I mean, that's another conversation. But when it comes to prevention and research, that's not, that should be nonpartisan, because, we're all breathing the same air and all the rest. What is your...
It should be nonpartisan, but unfortunately, with a lot of the diatribe we hear, actually, when you look at vaccination rates, oftentimes they are lower and highly red or Republican areas. So we're actually going to see more measles outbreaks, more whooping cough, things like that. We did see worse COVID outcomes, in highly Republican districts. And to me, that's, upsetting as well, because there shouldn't be variations based on where you live. We want to make sure everybody has access to accurate information and good health care. And this is just where I think it's so disturbing on many levels. When you look right now, the measles outbreak, 30 plus years, highest numbers. We're going to see long-term consequences for some of these children. The foodborne outbreaks with the secretary not acknowledging that they're happening. And even last week was the anniversary of Officer David Rose, losing his life protecting CDC.
Mm-hmm.
And that has to do with, violent rhetoric in our country that you can't have around misinformation. And I think more needs to be done on that as well.
It seems to me, and I've said this before with other scientists, that sometimes a lot of this has gone, it's happening because, yes, the rhetoric, ideology, and then I ask, well, where's that ideology coming from? And some of it seems to touch back to religion or one's faith being I guess, a catalyst for why people are not going to believe in science or believe in research or believe in data, that their religion overrides the ability to see that the data, is impartial. The data is not partisan. It's just the raw data. And when we get into some of these personal things like faith or religion or whatever, we get way off the rails. Is that
potentially? But I think it's what I thought was so ironic was during the hantavirus outbreak here in the United States, the CDC guidance on the website said that home monitoring was appropriate. Yet the NIH director / acting CDC director did federal quarantine orders to keep people in Nebraska. One of the patients asked for a medical review. A CDC medical officer reviewed her case, said it was appropriate for her to be able to get to go home, and Secretary Kennedy overruled that. And both Jay and Secretary Kennedy have criticized the CDC around movement restrictions during COVID. And that was a virus we didn't know a lot on. Hantavirus, we actually had data and science on, and medical professionals were saying, home monitoring was appropriate, but our political leaders actually violated individual liberties, movement restrictions. So that's where, that's different from religion, and these are people that had spoken strongly out about it. So that's something that it's hard for me to wrap my brain around.
Wow. Okay. So skill, talent, qualification is where we are. There's a lot of people that have been appointed to roles recently that by all measure, independent thinking, they just aren't, they don't fit the test, in my opinion. And one of them most recently is Dr. Heidi Overton, who is now going to be, one of the leading voices with the FDA. And I'm not asking you to pick favorites or not favorites, but the conversation is really more around qualification and also qualification to meet the moments that we're in. And it seems as though with her and with Dr. Schwartz, there seems to be some questions around their ability to meet the moment. Not that they're not qualified as physicians, but do you see what I'm saying?
I do, and what I would say with Dr. Overton is, she is a physician and she's currently working in government, so those those are two things in her favor. But the FDA is a really complex organization. She hasn't led anything that large, and she really doesn't have a significant background around regulatory. And when you're looking at regulations and food inspections and approval of medications, I would think you want someone that has, a deep bench in that if
Yeah.
you're leading others. Dr. Schwartz, on the other hand, she has worked in public health and clinical medicine. She has stated she believes in vaccines and was, over a lot of vaccine deployments. I hope she does well because I want CDC to thrive. But what concerns me is what she said at her all hands about, disagreeing privately with the secretary. I can understand if you don't agree with everything your boss says, to maybe not air those grievances publicly. But if it's something that's going to impact the lives of Americans, and she also didn't say that that didn't mean she wouldn't implement something. It's okay to maybe disagree, but then you shouldn't be implementing, things that can harm others. And that's where it was unclear what she would do.
Yeah, that's exactly the point. And in this moment, are they the ones to meet the moment? You certainly were. Happy anniversary to moving into a new direction. I guess I'll put it that way to end on a positive. It's always great to see you, Dr. Houry. We appreciate your leadership and your commitment to making lives better for folks here in the United States of America. Good to see you.
You
Stay
as well.
strong, and we look forward to having you back again soon, okay?
Sounds great. Thank you.
All right. Talk to you soon.